In the United States, coverage for telehealth services is regulated by federal and state laws. Across the country, there have been great improvements made with the expansion of reimbursement for telemedicine. However, these changes have not been made permanent, and there's still room for exponential growth. Things like increasing billable procedure codes, less stipulation regarding Medicare and Medicaid coverage for telehealth visits, and permanently requiring state-regulated health insurers to reimburse equally for in-person visits and telehealth visits are things that would promote great change. Implementing these changes would transform the world of telemedicine and make it more feasible for providers and patients across the country. So in Texas, telemedicine is not typically covered equally under state-regulated insurance plans. So more money is provided and reimbursement is provided for in-person visits than virtual. This makes the patient provider less apt to participate in a virtual visit over an in-person visit due to the increased costs associated. On the other hand, the patient may only have the option for a virtual visit for things such as immobility, lack of transportation, chronic or severe pain. So the limited resources for these patients in need increase the likelihood they won't seek care when it's actually needed, and that those types of diagnoses that could have been treated during a telehealth visit, since they're not having access to in-person, could ultimately lead to an ER visit or a hospitalization. Patients who do not have the ability to afford transportation are less willing to go to their inpatient visits because they cannot afford an out-of-pocket expense for an Uber or for an ambulance that could cost hundreds of dollars. Many patients have been interviewed regarding the benefits associated with telehealth, and they say they appreciate the safety and convenience also associated with the visit from their home. Some patients with immunocompromised systems have always had a fear, even before COVID-19, the pandemic, of leaving their home because they're so immunocompromised that they're afraid that they'll pick up something and that it'll send them to the hospital. There's also patients, from a psychiatric point of view, who have agoraphobia and are afraid to leave their homes due to having panic attacks. So social anxiety is another reason why telehealth expansion would be truly beneficial to our patient population. During COVID-19, telemedicine visits were about 50% of all visits. Those numbers have dropped down to about 20% now that the COVID-19 surge has ended, but many providers really still hope to use telemedicine as they did during the COVID-19 pandemic surge because they did see great benefits for themselves and their patients. One chief medical officer at the hospital in Michigan feels that the expansion measures taken to broaden telehealth should be permanently granted and further expanded so that telemedicine is easily accessible to everyone. So certain stipulations associated with telehealth visit reimbursement under Medicare and Texas Medicaid are making it difficult for patients to choose a virtual visit. Some stipulations inconvenience access to telemedicine, including the requirement for a patient to be in an established medical site, such as a mental health facility or supported living center, or in an in-office visit to have a virtual visit with their provider. Currently, Medicare and some commercial health plans are under an emergency order that will temporarily broaden their telehealth coverage due to the COVID-19 pandemic. And under the emergency telemedicine rule in Texas, state-regulated health insurers are required to match in-person reimbursement for all telehealth visits. Technology has been provided to these patients. Use of laptops, Wi-Fi has been granted to these patients, and I feel this is something that can be placed permanently, just as we did our students for virtual learning during the COVID-19 surge. So moving forward, I feel grants should be made permanent for expanding telemedicine on state and federal levels. Everyone who wishes to use telemedicine should be provided with the technology they need to do so. Coverage for visits should remain equal to that of the in-person visit. The stipulations should be lifted during the emergency rule that have been lifted during the emergency rule should be made permanent. Increased requirement for documentation, no in-person visit needed for an initial evaluation, etc., are things that I feel should remain in full effect. Telemedicine serves so many benefits to our providers in our community, not just during a pandemic, but in normal conditions also. I feel like this is something that could really promote great change and really help cut down on costs and cut down on the patient burden in our country. Thank you.